And instead of the total lockdown that's been taking place in many countries, in Sweden we have chosen a slightly different path. And I would just like to share some experience from that, and that this disease is here to stay. It can't be compared to SARS, because SARS was possible to get rid of. This disease will be here and around, and we need to find a way to live with it. And we can't just push that in front of us, and the total lockdown was most likely just push it ahead of us. So we need to find a way to live with it. Try to figure out what can we do in this specific situation to minimize the spread of the disease in that situation. And we have done that by a combination of voluntary advice and regulations. And that our laws in that area puts very much of the responsibility on the individual. The individual has a great responsibility to keep from spreading the disease to others, and that's what the law states very, very clearly, and that's then also where we've been working with very much. And this has built a great trust between the public and the agencies and the state. So we banned all visits to all people's homes, because we know that these people are very vulnerable and we need to protect them very much. We have also told high schools and universities that they should have all the teaching done on a distance learning pattern. That works very well in those ages, and it minimized travel in Sweden quite a lot, because the students, both to high schools and universities in Sweden, tend to travel fairly long distances. We have also banned mass gatherings, first to 500 people and then to 50 people. And even gatherings with smaller groups of people, we have issued a number of guidance to minimize the risk of spreads in those kind of gatherings. We have told people above the age of 70 to stay at home. They can go out and walk around, but they should minimize their social contacts as much as possible. So what has this led to? How did these non-lockdown measures work out? We have a fairly high death toll, I admit, even if I don't agree that it's increasing, and we have had a fairly flat level of that, and our cases have been stable for the last 2 to 3 weeks. We have had an RE around 1, slightly over, but not much over. When it comes to our healthcare system, it has been working rather well. We have had all the time, we have at least 20% of the intensive care beds have been empty, in spite of us having slightly more than 1,000 or 1,200 people admitted into intensive care so far. A number of them have already been released, but so the intensive care units have been working very well. We have done some modeling based on our own data, and it's according to that modeling, we reached a peak of transmission a couple of weeks ago when some 70,000 people in the Stockholm area probably got infected. We believe that some 25% of the population have had the disease by the 1st of May. This is in the Stockholm area. We have to realize that this epidemic is very different in different parts of Sweden. In the south of Sweden, we have had very, very few cases, in spite of it being very close to Denmark, where there's a lot of cases. So the disease in general keeps on surprising us, I would say.